One of the top priorities for the Camp Grace staff is safety. Nothing can ruin a week for a camper faster than an avoidable illness or injury. Camp Grace has established some general rules and guidelines that will help both staffers and campers from injury and sickness. For more information on this topic, refer to pages 32 through 34 on your staff training manual. Shoes should be worn at all times when campers are outside of the cabin. Camp Grace is filled with sharp objects on the ground and stinging insects. There are also continuous projects on the campground, so pieces of glass, metal, and other sharp equipment may be hidden in the grass. It's best to play it safe. Shoes on at all times. Motivate your campers to eat at all meals. With picky campers, encourage them to try the food. If they continue not to eat, be sure to tell a head counselor, but do not force them. Remember, this also includes hydration. Most common ailments like muscle aches and headaches can be solved with a couple cups of water. Hydration is important. Involve all campers in activities and discussions. This will help combat homesickness. Identify the campers who are isolating themselves and get to the heart of the issue. The faster you can take care of homesickness, the better. Remember, homesickness is contagious. Please insist upon the cleanliness of your campers. That includes making sure they brush their teeth, wear different clothes on a daily basis rather than their favorite Panthers shirt, and to shower daily. If possible, keep open foods outside of the cabin. Trust me, you do not want the mice and insects that accompany open food. As a general rule, be on the lookout for safety hazards and report them to full-time staffers unless the problem can be solved without neglecting your campers. Watch particularly for broken glass, holes in the ground, objects on the floor that people could trip on, and other hazards. Communication is key here at Camp Grace. Here are some guidelines pertaining to communication with the nurse and first aid provider. Report all illnesses to the nurse or first aid provider for treatment and documentation. The nurse will then keep the cabin leaders informed of the camper's condition and limitations. Any information given about a camper's medical record is to be kept confidential. Remind campers they have to report to the nurse for medication, treatment, and checkup. If the nurse is not there in the infirmary, the location will be posted on the door along with contact information. Remember, if you have any questions concerning health safety, ask the nurse. Be watchful for these signs of illnesses: headaches, loss of appetite, insomnia, unexplained fatigue, earache, sore throat, red or swollen eyes, skin sores, indigestion, poison ivy, rash, fainting, colds, diarrhea, nausea, and vomiting, and any kind of pain. Some situations require special care. Do not attempt to treat a severe injury or illness alone unless it is an emergency that needs to be treated immediately, such as severe bleeding, shock, or no breathing. In case of a fallen camper, do not attempt to move him or her if you suspect that there is a broken bone, torn ligaments, or any kind of head injury. To begin, ask how they feel and what happened. If the camper struck their head, assume there is an injury and do not move the camper. In case of a head injury, there is a chance that the victim is stunned. Send someone to get the nurse or first aid provider immediately. Under no circumstances should you leave or move the camper unless the area becomes dangerous. If the camper falls unconscious, record how long it lasts. Additionally, refer to page 34 in your training manual for more information on specific medical situations and how to handle them.
During training week, you will be trained in the various different electives that we do at camp. Though every activity may be different, the general process in getting it started is all the same. To begin, pray. In every activity, correct and proper procedure is trained to every staff member. However, there is always a risk of injury, even with the most trained elective leader. God may also open up opportunities to share the gospel during the electives that you lead. Thus, it is important to bathe whatever you do at camp in prayer. Be familiar with the rules of the electives and the materials that are needed to carry them out. If there is a biblical lesson that goes along with the elective, review it so you can effectively communicate it to the campers. Most of the time, a senior support staff member will be at electives ahead of time to set them up. However, we encourage the counselors who are running the electives to be there before campers in case of any last-minute preparations. Always think safety first. Any kind of deviation from the standard elective guidelines that compromises safety are both dangerous and not allowed. With that in mind, remember to let the campers have fun. Sometimes younger campers will have difficulty doing harder electives, such as archery or boating. Sometimes it's best to let them try and do it in an easier way, rather than having them learn perfect technique. Remind yourself to be patient. You might have to spend more time with some campers because they have never climbed a rock wall before. As campers start arriving, pray again and do the elective to the best of your ability.